Welcome back to Special Report. In this happy hour edition, we're going to head back out to Nashville, Tennessee here momentarily to check in again with Dr. Gina Michelle Backus, who are doing a special report there. In the meantime, though, in the age of so much misinformation, it's really hard to tell, right, what's real and what's not, or what to worry about and what's all just hype. I mean, this winter, several European countries actually encouraged their citizens to stockpile prescription medications after severe shortages last winter. And now some Americans wonder, well, hey, should we probably do the same thing? Joining us live to help us separate fact from fiction is Dr. Peter McCullough. Always good to see you, Doctor.
Thank you.
Yeah, it's really confusing. And again, I know we're with the media, but with so many reports, people get inundated. They don't know what to do. It raises anxiety. It raises our stress levels. So let me ask you, is this something Americans should honestly be concerned about right now?
I don't think so. You know, China and India together provide about 90% of our generic supply. Most prescriptions written by doctors are generic drugs. The Europeans had a concern because of the Russian-Ukrainian conflict and Russia turning to China, influencing trade practices there. We heard about that, by the way, in the interview, the Tucker Carlson-Putin interview. Mm-hmm. I think that's where the concerns came from. The European drug supply wasn't threatened. Now, we know by quantity, including all drugs, China is about 23% of the supply to the United States. So we have a diverse supply, but we'd want to keep a watch on this and make sure that, you know, critical drug supplies weren't threatened. The group purchasing organizations, which are the intermediaries, they're the ones that the U.S. Agencies ought to really look to make sure that we're in good shape.
Well, Doctor, I mean, let's be honest. I mean, most of us probably didn't give our supply chain really a second thought, at least before COVID. Now, U.S. intelligence officials warn, you were just talking about China and how it could use its domination over supply chains as perhaps a weapon, let's say, in a cold or hot war with the U.S. So if you can expand upon that a little bit.
Well, it's possible. You know, the greatest threat is specific drug shortages. So this is known for in-hospital drugs, for instance. The group purchasing organizations, there's a oligopoly of these organizations. They can actually drive down the price of generic drugs so low that the suppliers just basically go out of business. They can't supply the drug. And then the patient, the American, is offered a more expensive drug in the hospital. And that's a method by which the GPO gets its percent earnings up. But when we're talking about over-the-counter prescriptions, most of this is just a typical supplier-purchaser arrangement. And, others are getting into this. Mark Cuban, you know that he's worked to try to become an independent source, and certainly Sam Walton and Walmart. So I think we have enough diversity there. But our, government officials looking over trade and the limited number of group purchasing organizations, I think ought to have some meetings or some work groups to ascertain, is the drug supply assured, particularly for in-hospital drugs?
Right. So that would be my question to you. I mean, is this a national security threat when it comes to China, let's say?
It theoretically could, if there were specific drugs. I'll take some easy ones. Ibuprofen, acetaminophen, something like 90% of that comes from China. Well, if that was shut off tomorrow, I mean, mothers would be having a tough time handling pediatric fevers, for instance. So, diversity is always a good thing economically, and it's now is a good time. People are raising the question that our economic agencies dealing with these issues ought to spend some time on it.
Yeah, for sure. So, I mean, as you know, globally, we are entering dangerous times. You talked about Putin. We have wars in Ukraine, a war in Israel, attacks on U.S. soldiers across the Middle East. I mean, at least, I think at last count, more than 170 recently. China now threatening Taiwan. How much do you trust the Biden administration to keep Americans safe?
The Biden administration is in many ways let us down across the five major areas that we that we want to hear about. So that's foreign affairs, domestic affairs, the economy, health, and education. And your domestic affairs would include immigration. We haven't heard any new ideas. We haven't seen any bona fide progress in any of those areas. And if one was to evaluate it, the general conclusion is things have gotten worse. So I can tell you, sitting from my point of view, my trust level is low. I've been very dissatisfied with the pandemic response, vaccine safety, all the issues we've seen played out during the 3 years of Biden in the office.
Yeah, there are critics who claim that urging people to stay safe by being prepared is actually a scare tactic. So what would you say to those people, and why is self-reliance, more importantly, versus reliance on the current medical system, especially given what just happened, so important?
I advise the wellness company, now a nationwide alternative source of healthcare, as a chief scientific officer. And we had the aspiration to simply give people an alternative, an affordable, cash-based alternative that can be in addition to healthcare, but 24/7, giving people important products like the kits. The kits give people the ability to handle problems themselves without every single time relying on urgent care, ER, or the hospital and doctors to handle it. And so we're at the point where people can actually self-diagnose a urinary tract infection, a yeast infection. They can readily see a cellulitis or a skin infection, bronchitis. We learned this through COVID, and follow a simple guidebook, telemedicine support if needed, and handle problems themselves. It's far more affordable than making these episodic trips to the, to ER, urgent care, or hospital.
Yeah, exactly. And it's information that you can trust from well-renowned doctors who actually care about your health, like yourself. So be sure and check out the website. You're seeing the kits right there on your screen. You never know when the next emergency is around the corner. They're great to have for not only you, but every member of your family. There's the website on your screen. It's twc.health/voice. That is the promo code you want to use to save 10%. Dr. McCullough, thank you as always, and I hope you have a blessed weekend. Thank you so much, sir. Good to see you.
Thank you.
Stay healthy. All right, coming up next, we're going to head back out to Nashville.